This is what's happening right now in China's major hospitals. For Chinese people, if they could time travel, one thing they may least want to do is go back to the time between 2019 and 2022, as that was the 3-year pandemic that sealed off the city. Yet, the familiar scene is happening again in China. China's Health Commission announced the outbreak on November 26th, saying that the recent outbreak involves 7 pathogens, with mycoplasma pneumonia being the more serious condition. In other words, it's officially announced that 7 viruses are now circulating in China. Some foreign medical experts believe that mycoplasma pneumonia can be easily cured with commonly used antibiotics. Over the past few years, Beijing had an obviously opaque and poor track record of covering up outbreaks. So outsiders are wary of what virus is causing China's hospitals, especially children's hospitals, to be overcrowded. Doctors in China have been saying that there is no cure for upper respiratory tract infections. This has shocked many who can't believe that there isn't a cure. It thus fueled speculation among netizens that the current virus is probably a variant of the new coronavirus.
My child's test results show positive in both mycoplasma pneumonia and influenza A. I think her condition is quite complicated. Her dad had been lining up in the hospital for test results. After getting test results, he told me there were still 200 more patients before us.
Patients are allocated to different internal medicine departments. We have also added outpatient services even on the weekends. Depending on their conditions, patients may be directed to the emergency department, the fever clinic, or the infectious disease department to ensure that they can receive medical attention upon arrival at the hospital. With over 3 million fans, a critical care expert at Wuhan University People's Hospital recently posted on his certified Weibo. A nationwide epidemic of mycoplasma pneumonia infections occurred in China in October-November, accounting for the dominance of respiratory infectious diseases. Many hospitals are overcrowded in pediatrics, and there are many adults infected with pneumonia. This process was also accompanied by a small number of new coronavirus infections. On November 29th, the Chinese Center for Disease Control and Prevention, CDC, wrote in an article that for respiratory diseases such as influenza and the new coronavirus, it was recommended that key and high-risk populations be vaccinated in order to reduce the severity of infections or post-infections. Elderly people over 65 years of age who hadn't been vaccinated should be vaccinated at the earliest possible time. And if they had been vaccinated before with an interval of 5 years, they may be considered for revaccination. Even as a layperson, it's common sense that the vaccine must target the virus that is causing the infection. Now officials are claiming that 7 viruses are circulating. So, what vaccine should be administered? Which virus is causing the heavy outbreak? Or maybe the CCP knows the real answer. This was a city in northern China on November 24, 2023. Due to the recent rampant spread of so-called mycoplasma pneumonia and other influenza diseases, the local emergency center organized personnel to enter school campuses wearing white protective suits to carry out disinfection work. This outbreak in China continues to heat up over a wide geographic area. It's not only raging in the north, but it's also bad in the south. Many of our audience might have watched our last episode on this new epidemic. As children are a major victim of this outbreak, it can be seen that children's hospitals are overcrowded. With no space available, some adults are said to carry campers and yoga mats as to have a place to lay down the children. In view of the highly contagious nature of the disease, a number of places such as Beijing have issued documents requesting teachers and students not to go to work or attend classes with illnesses. Schools in Guangdong Province and Jiangsu Province have already taken the temporary precautionary and control measure of suspending classes for the whole class and requesting them to rest at home to avoid repeated visits to the doctor. The official media have deliberately kept a low profile in handling such news. For example, on November 24th, a first-grade class at an elementary school was suspended for 4 days, with only a few media outlets reporting the news. According to the school's documents, the cause for suspending the class was due to sickness. 1/3 of the class suffered from mainly influenza and fever. This class was thus suspended for 4 days as required by the local CDC. Although the official media has been playing it down, netizens in many parts of China have been posting notices of school closures. On November 28, the teacher in Hebei province showed a video of 23 kindergarten kids taking a leave of absence and only 3 attending class, sparking a hot debate. Some netizens said, "These 3 kids have strong immunity." Many netizens reported that their children's kindergartens were in a similar situation. In one case, only 1 child was left attending the class. The word fever has hit the top of China's Weibo search engine. Weibo was flooded with posts from netizens complaining of high fever and sickness. For example, this entry said, "It's killing me. The fever went up to more than 39 degrees Celsius or 102.2 Fahrenheit 3 times a day, leaving me dazed and confused. Next, the throat felt like knife scratching. Last year, with the new coronavirus, I had a high fever with my kid. We looked after each other. We are repeating it this year." Someone also described, "I never get sick but have a fever of 39.2 Celsius or 102.56 Fahrenheit. Thanks to the leaders for protecting me and giving me 2 days of leave. I have to say that the fever and body aches are killing me. Thanks to myself for dragging my body with a high fever to line up for a blood draw and see a doctor. Really bull. Now I think being healthy and alive is really good." Lines of more than 1,000 people in hospitals continue. At this hospital in the north, the number of patients seen on the display screen has reached beyond 1,300. One of the reasons this outbreak feels so scary is not just because of its intensity, but mainly because it's so similar to the one 3 years ago in 2020. Aside from the fact that Dabai, people in white jumpsuits, as we mentioned, are back in action, even Fangcang hospitals or makeshift hospitals, which are closely tied to the city lockdown in people's minds, has been reopened once again. There is a lot of information online about places where these hospitals have been activated due to the medical squeeze caused by mycoplasma pneumonia. For example, some patients' families sent out messages that they had been admitted to Fangcang hospitals. However, doctors suggested removing the word Fangcang and replacing it with expressions like a negative pressure ward. The screenshot reads, "Hello, I am a staff member of the hospital. I saw the video you posted and thank you very much for your interest in the work of our hospital. It's just that the mention of the word Fangcang may bring panic to the public, so I suggest you revise it to negative pressure wards so that the description may be more accurate." The patient's family responded, "I feel that we should push the opening of the Fangcang hospitals. After all, the hospital is packed with people. It's even difficult to get in line. People are all taking IV drops sitting on benches. It's like a farmer's market. People have to fight for everything every day, such as the nebulizer. Children are the future of the country, and we have Fangcang hospitals. Why don't we start using them?" The patient's family also said, "We are in the former Fangcang hospital. I also want to advocate for opening the Fangcang hospital in areas with serious infections. Some Fangcang hospitals are no longer serviceable. The government spent so much money on building Fangcang hospitals. After the epidemic was over, this became a spare facility for everyone. It's so serious this time. Why don't you have it open? We pay out of pocket anyway. It's not like it's free." As the patient's family member said, a Fangcang hospital, like any other large building, costs a lot of money to build, and it would be a shame not to use it at such a critical juncture. But what they may not realize is that the government may be playing a big game of chess. This is one of the explanations used by the CCP propaganda apparatus. Here's a video from earlier this year, in the spring of 2023, after the end of the 3-year epidemic. It's discovered that Fangcang hospitals are still being built all over China.
方舱医院久违的名词
The long-forgotten term of Fangcang hospitals are actually still being built in many places despite the epidemic having been over for so long. It sounds offensive and astonishing that it gives us goosebumps, as if they want to go back to the previous state of epidemic control. China Business Network reported that Jiamusi in Heilongjiang is building a hospital. Harbin is also bidding for the construction of the Fangcang hospital, and Wenshan in Yunnan is also bidding for the construction of the hospital, with tens of millions or even hundreds of millions of yuan involved. Is this a case of too much money waiting to be spent? No, but the money allocated can't be returned. Somewhere in an interview with the media, it was explained so. The application for funding was submitted before the end of the epidemic. Now the funding has been approved, so it has to be built. So why can't it not be built? Because the money would be taken back and it'll affect next year's budget allocation. In short, it's free money that has to be spent. Even if the epidemic has been over for a while, Fangcang hospitals are at the end of their lives, and even if the policy of city lockdown is over, this funding has to be spent and used up. It feels like the taxpayers' money is a windfall. It's hard to swallow. In the face of the media's follow-up questions, one jurisdiction explained, in the name of building quarantine sites, the actual use of the facility wasn't specified yet. I think it is not a matter of unspecified usage, but a matter of not being able to make it explicit. It's because the claim of building Fangcang hospitals doesn't make sense, and the claim of other uses would lead to suspicion of misappropriating funding or changing the designated use of funding. No matter how good the reason is, others will find fault. The government and people are tightening their belts, and its true money is tight. They spend money like this even when money is in short supply. They spend it generously, as if well justified. How can you expect the people not to feel the pain? That is taxpayers' money, okay? They are using it for the epidemic prevention and control that has long been over. It's not even spending, it's wasting money. It's time to adjust our budget policy. The budget is lifeless, but people are alive, and the situation is constantly changing. We should use the limited funds for people's urgent needs, rather than treating it as assets of a certain department that must be used up quickly before it expires. Don't these cities have more urgent things to do that are in need of money other than adding a few useless makeshift hospitals? Why do some places build shelters with dozens of ventilators? Why did a medical device company win the bid with only 3 days' notice? If they insist on spending all the money and spend it as much as possible, how can people not speculate on it? How is it possible to expect people to be quiet about it? It's recommended to stop the construction of makeshift hospitals as soon as possible. People aren't really afraid that the epidemic and the control would come back, but they are disgusted that money is being spent like this. They are shocked that money is dared to be spent like this. The finances are so tight, so why don't the makeshift hospitals stop taking up so much money? It may not have occurred to this commentator that the government, which at the time appeared to be wasting money, might actually be wise in their decision-making when looking at it a few months later. Will the people living in the Fangcang hospitals ever wonder who on earth is responsible for all this? China's new outbreak has attracted international attention, with ProMed, the global infectious disease surveillance network, alerting to a widespread outbreak of an unidentified respiratory disease. On November 27th, WHO officials declared to the public, based on information provided by the CCP, that the surge in cases in this wave of outbreaks isn't as high as before the new coronavirus pandemic, and that no new or unusual pathogens have been found. The Beijing government hasn't released any data on how many children were infected, how many were hospitalized, how many were critically ill, and how many died. So it's rather strange as to what data the WHO based its conclusion on. At the beginning of the last epidemic that happened 4 years ago, the CCP told the WHO that the virus wasn't transmissible between humans and that it was preventable and controllable. The WHO repeated the CCP's claim. What happened later proved that the WHO seriously underestimated the virus. The passive and delayed responses of the WHO deprived many countries of their vigilance and the best opportunity to curb the spread of the virus.